think initially it was downtown, close to Person Street, and then it moved up on the hill back in the earlier part of the last century, of the 1900s, up to the top of Haymount. And then a couple of decades after that, it moved to its current location over on Robeson Street. It's been in operation the entire time. It's changed hands a few times. It is the oldest private hospital in North Carolina that's still in operation. So out of the health system, it's one of our smallest hospitals, but it is the oldest in the health system.
Michael, how does Highsmith Rainey fit into the Cape Fear Valley health system now?
Yeah. So we offer a lot of services at Highsmith Rainey, a lot of outpatient services, which I'm sure we'll get a chance to talk about in a little bit. But it plays a very specific role in our health system as being the only LTAC within our health system. That's LTAC, which stands for Long-Term Acute Care Hospital, and it's the only one in the health system. We have about 66 LTAC beds there, and it serves the purpose of meeting the patient's needs who are qualified for LTAC services, that being lesser than acute care like you would find in the medical center, but where they're not quite ready for either skilled nursing facility services or inpatient rehab services. We also are strategically located to serve the population specifically in the downtown area. We are located right on Robeson Street, right across from the Medical Arts Building and right across from the bus station. So we have a lot of folks who find access at Highsmith Rainey easier because of our closeness to the downtown area and also to public transportation.
Compared to how I remember the hospital not even a decade ago, like I said earlier, and like you said, I had no idea that Highsmith Rainey provides all of these different services to their patients. Can you give us a little more detail about the various services that Highsmith Rainey provides?
Absolutely, absolutely. So in addition to the long-term acute care beds that we have there, we also have outpatient services in radiology and lab. We have CT, ultrasound, plain film x-ray there for radiology services. We have outpatient lab services, which includes walk-up services. We can work you in for lab services as well as those radiology services. We have a surgical suite with 3 operating rooms and 2 procedure rooms where we do about 3,500 surgical cases annually. And we also have transfusion services up on the 5th floor where we do outpatient blood product transfusion services. And then we also have our Highsmith Rainey Express Care, which is one of several express cares within the health system. And we see patients there from 7 days a week, from 9 a.m. to 7 p.m. there in the express care. So a lot of outpatient services that may not be familiar to folks. We get a lot of folks sent over from our medical arts building where there are many suites there with physician practices as well as a pharmacy. So a lot of folks come over to us for outpatient diagnostic services and lab services. We do have, I think with all the history, and there used to be a lot of private practice primary care physicians that attended their own patients in years past at Highsmith, and so I still think it's a favorite referral destination for some physicians in the community. But I know that, like, just my family, since I've come to Highsmith, has been utilizers of the services there that we did not realize were there previously. And oftentimes we're able to get folks in a little more quickly for those outpatient services than they can at the diagnostic service center or at the medical center itself.
Ladies and gentlemen, Highsmith Rainey President Michael Tart on Making Rounds Live. Remember that we are reaching the masses this morning 3 different ways, really. First, we're broadcasting on WIDU and the WIDU Radio Network. Don't forget the WIDU Radio Network. They serve Cumberland, Robeson, and Scotland counties. And we are also streaming live on Cape Fear Valley's Facebook page. So if you have any questions that you would like to get to Mr. Tart, what you can do is leave those questions in the comments section. Lindsay will make sure that we get those questions to Michael while he is here today. And finally, Cape Fear Valley has a YouTube channel, and we are also streaming live on the YouTube channel. So make sure that you share that information. Make sure you share the broadcast. Let everyone know what we're doing. And this is an interesting program, or an interesting episode. So if you're like me, you're not a good middle person. So just share the link, and then that way they have the information there. Michael, you mentioned LTAC. And once again, I just want to make sure our listeners understand, how exactly does that work?
Sure. So the long-term acute care services that Highsmith Rainey offers are unique within our health system. There are only half a dozen LTACs within the state. And so we get referrals because it is a referral-based service.
It is, okay.
We do get referrals not only from within the Cape Fear Valley Health System, where we receive about 60% of our referrals, but we do get a lot of referrals from other health system hospitals, more regionally than anywhere else, like Southeastern, Wake Med, Duke, UNC, all the way down to McLeod, more regional, and WOMAC. But we have had folks come as far as, Guilford County,
Wow.
out towards the coast and a little bit closer to the mountains, because there are so few LTACs within the state. Long-term acute care is unique in that sometimes people no longer require the highest level of service, i.e., what's required in like an acute medical center like Cape Fear Valley Medical Center or our other inpatient locations. But they're not quite ready to go to outpatient services or to be discharged to home or even to qualify for skilled nursing facilities or inpatient rehab. We specialize in a few areas of care, especially we have disease-specific certifications from the Joint Commission, which is a third-party organization that oversees and credentials healthcare facilities. We have disease-specific in certifications in wound care as well as respiratory care. And though we see folks with varying diagnoses, our primary diagnoses that we see folks with is respiratory issues, like maybe someone has been on a ventilator or has a trach and is ready for weaning off of the vent or off of the trach. Folks can be admitted to the LTAC, and we will work with them and their family members and the respiratory therapists on that. We do a lot of wound care for significant wounds that require long-term therapy, treatment, debridement, and a lot of follow-up. We do a lot of that. We also see a lot of folks with long-term IV antibiotic care needs. And I'm talking, more than one IV antibiotic prescription and, greater than a week's worth of therapy required. But we do also get folks with, post-traumatic brain injury who are not yet ready for rehab, folks who have other neurological illnesses going on, or respiratory issues, or chronic kidney failure or chronic diseases that need to be managed, again, where they're not quite ready for either outpatient services, discharge, or a skilled nursing facility. In the LTAC, we have physical therapists, occupational therapists, respiratory therapists. We have certified wound care specialists there, and they're there 24/7 to treat issues that patients may have. We do have, within our 66 beds, 8 of those beds are ICU beds, and we have physician hospitalists servicing our patient beds, as well as we have a wonderful team of physicians as well as advanced practice providers caring for our patients. And so we're able to offer those services. We also have those radiology services that I mentioned on the outpatient side are also available, as well as the lab for our inpatient patients as well.
You mentioned outpatient surgery. What exactly is considered an outpatient surgery?
So within Highsmith Rainey, we do not have the ability to admit patients to our floors after surgeries. And so we focus on outpatient surgeries where the patient would come in, check in the day of surgery, receive their surgery, be treated, go to our post-surgical suite for recovery, and then discharge back to home or to the facility where they came from that same day. We do about 3,500 surgeries a year. We have 3 ORs and 2 procedure suites there. We provide an excellent experience for both our patients as well as our surgeons. The surgeons that operate over at Highsmith really appreciate the efficiency as well as the care that we provide our patients. We have excellent patient experience scores at Highsmith in our outpatient surgical suite. We focus on a few specialties, half a dozen specialties or so, typically operate at Highsmith Rainey, that being urology, ophthalmology. We do a lot of eyes over at Highsmith Rainey. We do some general surgery cases over there. Plastic surgery, both elective and medical plastic surgery services.
Okay.
And a few ENT cases per year. And then now we are just bringing vascular surgery as well as interventional radiology services over to Highsmith Rainey. So we'll be doing those cases there in the future.
Wow. Let's talk about the outpatient radiology and lab services.
Absolutely, absolutely.
Can anyone use those?
Yes, absolutely. As I said, we have CT services there, X-ray, ultrasound. We have scheduled visits. We maintain a schedule for each of those, as well as walk-in services. Tina Gray is our manager of radiology services there. She's been with us about as long as I've been at Highsmith, doing a wonderful job. We're looking to expand our services, but it's really easy to get in at Highsmith. You can call and schedule an appointment. You can also, if you have a written order from your physician or an order that's sent over to Cape Fear Valley, we can schedule you and get you in. We also have the walk-in services, as I mentioned. The great thing about Highsmith is it's a smaller footprint. You can park right close to the front door, come right in, register right in our front first floor lobby, and then we escort our folks up to the radiology suite for the radiology services. In addition to the radiology services, we also have the outpatient lab where we service not only our express care and our inpatient patients, but also the community. We have walk-in lab services. Again, much like radiology, you can bring the lab order in with you or have your physician send the orders to the Cape Fear Valley referral system, and we'll see those orders and can take care of your lab services as well.
Now, once again, I want to make sure our listeners understand, do they need to see a doctor first? And I know you said walk-ins, but I just want to make sure.
Yes.
Do they have to have an appointment?
Yes, and thank you for clarifying there. They don't necessarily have to have an appointment for the walk-in services, but they do have to have a physician order for those services. So you can't self-order for either the lab services or the radiology services, but typically whether it's a specialty provider or a primary care physician, they're going to make the recommendation and create the order for those services and either send them over to the hospital, or sometimes they'll even write a paper script order and give to their patient to come in for those outpatient services.
Ladies and gentlemen, Mr. Michael Tart on Making Rounds Live. Michael, I'm on a first name basis with him, because I know someone, she's being so disrespectful. No, I'm on a first name
We're
basis
friends
with
here.
him because I have worked with him during the vaccine clinics. I've worked with him in the community, so I feel that we're beyond the formalities.
Absolutely.
So, Michael, let's talk about the Highsmith's Express Care's major question. When should we go to an express care location over a primary care clinic or the emergency room?
Absolutely. Great question. Well, first of all, let me say, before I say anything else, if you are having a medical emergency, you should first call 911 or seek care at one of our emergency departments, our EDs, within the health system or wherever is closest to you. But we encourage folks, initially, if you're having a medical emergency, call 911 for that. So that's first off. Highsmith Rainey Hospital does not have an emergency department. They had one in years past, but there's not been one there in over a decade at Highsmith. We do have Highsmith Rainey Express Care, and it is one of several Express Cares within the health system. What makes the Express Care unique is we do not provide emergency department level services. However, we do typically treat a patient with on average, a higher acuity level than what you might see in a primary care clinic. A lot of folks, I think, can understand the challenges sometimes of getting in with your primary care physician in a timely manner. And if you have not necessarily an acute need, but if you have a need where you need to be seen within, let's say, 24 hours, the Express Care is a great place to go. It is a walk-in basis only. We do not take appointments. It's open 7 days a week from 9 a.m. to 7 p.m. There's only a few holidays annually where we're closed. We take those walk-in services. We'll see, on average, 40 to 50 patients per day in the Highsmith Rainey Express Care, as well as at our Health Pavilion North location. They have access to the services, what we call point-of-care labs, which are labs that are performed in the Express Care space itself. They have access to the outpatient lab services at Highsmith Rainey, as well as to those radiology services that we talked about a little earlier, CT, X-ray, and ultrasound. And so we're able to oftentimes provide a higher level of service than what you would see in like a minute clinic type location, or even in a primary care location. We're able to see folks in a timely manner and provide that service same day.
Michael, since we've only got a couple of minutes before we have to take our break, there's one question that I really and truly wanted to get out, and I have a personal story that I wanted to share. What if a person who goes to Highsmith, what if they can't pay the hospital bill?
Great question. So Cape Fear Valley's mission is to improve the lives and health of every patient that we touch. And that is regardless of ability to pay. In our community, we have a lot of uninsured and underinsured folks. And Cape Fear Valley, and that includes our Express Care at Highsmith Rainey, is happy to see folks regardless of their ability to pay. Our goal is to keep patients treated as close to where they live as possible. So the geography of Highsmith Rainey Express Care is helpful because it's located downtown. As I said, it's easy access from the bus station. But it's also a goal of ours to keep folks out of the emergency room when they can be treated at a lower level of care. That's a best utilization of resources. It's most responsible from a patient standpoint. That way they're not sitting in an ED for several hours and they can be treated elsewhere. But if a patient comes in and they are either uninsured, underinsured, whether they can pay towards their bill or balance that day, we are happy to see them. Cape Fear Valley Health System has a robust charity care program that patients can apply for, and we work really hard to work with our patients to adjust balances where appropriate when people qualify for our charity care program. But I would just ask the community, anyone in the community, don't let your inability to pay for that visit today stop you from seeking care at the Express Care. Because again, if it's appropriate for you to seek care at the Express Care in terms of what your illness or your need is, we would much rather see you there than have to go and sit in the emergency room for something that could be taken care of at a lower level of service. Again, our Express Care is staffed by physicians and APPs, many of whom formerly worked in the emergency department. We use the same electronic health record as the emergency rooms within the Cape Fear Valley Health System. And so we have access to that. We can easily transport folks via ambulance over to the emergency room if needed, if they need more acute care than what we can provide at the Express Care.
And about the charity. After Darvin passed, because Darvin was the primary breadwinner, and I lost all of the benefits. So in order to keep my doctors, and basically I had to apply for the charity. And I was able to keep my doctors. I was able to get my prescriptions. So I'm really thankful for the charity program. Now, excuse me, is there anything that you would like to add or tell our listeners about Highsmith Rainey before we close out the first segment of the show?
Well, again, Highsmith Rainey is a gem within the health system. I hope it doesn't remain a hidden gem much longer. We have a lot of opportunity to care for patients within our community, especially within our community close by. We welcome folks to come to Highsmith Rainey, especially for those outpatient services where they can direct their care within the health system. If anyone has any issues or needs anything, they can reach out to us. I think Lindsay will provide contact information for both the Express Care as well as for the outpatient radiology and lab services. We are happy to take care of our community. It's just a blessing to be able to be a blessing to our community, and we're appreciative for the time today.
Ladies and gentlemen, Highsmith Rainey Specialty Hospital President, Mr. Michael Tart. Michael, thank you so much for being on the show today.
Thank you so much, Omega.
Now, when we return, we are going to talk about Black maternal health. It's an issue that was so important, it received a presidential proclamation last month. And we'll talk about that when we return. Cape Fear Valley Health's Making Rounds Live. Thanks for joining us.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The WIDU Radio Network.
God bless you. I'm Pastor Al McAllister, the pastor of Rafa Ministries Family Center Incorporated, and you are listening to Wake Up.
My name is Pastor Jerry Swinney. I am from Bethel Christian Assembly, formerly New Bethel Pentecostal Holiness Church, located at 1065 Progress Street, here in the city of Fayetteville, North Carolina. And I'm glad and proud to be a part of Wake Up.
Hello, I'm Dr. Teresa McAllister, the founder of Rafa Ministries Family Center, and you're listening to Wake Up.
The latest High Point University poll finds that about 2/3 of North Carolina residents, about 67%, said that they will travel within North Carolina this summer. This is a crucial day in former President Donald Trump's so-called hush money trial. Lawyers are set to deliver their closing arguments in the case. This spring, the North Carolina Division of Motor Vehicles is piloting the use of self-service kiosks in several grocery stores. There will be more added later this year. A series of powerful storms in the central and southern U.S. over the Memorial Day holiday weekend has killed at least 22 people as they left a wide trail of destroyed homes, businesses, and power outages. A house along the eastern North Carolina coast is left in pieces after officials say it collapsed early this morning. Cape Hatteras National Seashore says cleanup activities are underway at a house at 24131 Ocean Drive. Mike Rayleigh, NCN News.
I'm Jamie Manaselli, WIDU Radio News. There will be a public hearing at the City Council meeting tonight for the proposed fiscal year 2025 annual operating and capital budget. The City Council is considering a $319.9 million proposed budget for fiscal year 2025. That proposed budget includes a tax increase dedicated entirely to addressing public safety personnel who keep the community safe and secure. It also includes a tax increase for the downtown municipal service district intended to support and continue existing services in downtown Fayetteville. On Friday, Governor Cooper met with business leaders in France as part of an economic development trip, including Schneider Electric. The governor discussed investment opportunities and job creation in North Carolina. The North Carolina delegation includes the governor and first lady, as well as officials from the Office of the Governor, North Carolina Department of Commerce, and the Economic Development Partnership of North Carolina. From WIDU Radio, I'm Jamie Manaselli.
Good morning. A bright and beautiful day is in the forecast. It is going to be hot this afternoon. Highs climb into the mid to upper 80s thanks to plenty of sunshine. It is feeling a little bit less humid outside today. Tonight, it's mostly clear and quite comfortable with lows in the upper 50s to lower 60s. But much less humid tomorrow, partly cloudy and comfortably warm. Highs are in the low to mid 80s. I'm meteorologist Kat Campbell in the Weather Center.
Wake up, catch the vision, join the team. This is Pastor Reginald Johnston of My Father's House Christian Church right here in Fayetteville. We want you to wake up and join the team. Behold, how good and pleasant it is for brethren to dwell together in unity. It's good when we come together. We're one body, many parts. We desire that you wake up and join the team. It's good to be a part of Wake Up. Wake up, join the team. We will see you in Jesus' name. God bless you.
Looking for the perfect ride to navigate through life's adventures? Look no further than Bryan Honda, your premier destination for new and certified pre-owned Hondas in Fayetteville. Conveniently located at 4104 Rayford Road or on the web at bryanhonda.com. Bryan Honda is your one-stop shop for all your Honda needs. Step into the driver's seat of the latest 2024 models, from the sleek and efficient CR-V to the sporty Civic, the adventurous Passport, or the spacious Pilot. With new inventory arriving daily, there's always something fresh waiting for you at Bryan Honda. Worried about financing? Fear not. Bryan Honda offers hassle-free financing options to get you behind the wheel of your dream Honda in no time. And once you're on the road, trust our expert team for a fast and reliable service, keeping your Honda running smoothly mile after mile. Visit our showroom today at 4104 Rayford Road in Fayetteville or on the web at bryanhonda.com and experience the Bryan Honda difference for yourself. And remember, nobody beats a Bryan Honda deal. Not now, not ever. Not ever.
Think earning a degree is out of reach? Well, if you're a North Carolinian from a household making $80,000 or less, it's time to think again. Because the new Next NC Scholarship could cover all of your tuition and fees at any of the 58 NC community colleges. Or at least half, if not all of your tuition and fees at one of the 16 public universities across the state. The best part? It doesn't have to be repaid. See if the Next NC Scholarship could be the opportunity for you and how simple it is to apply at nextncscholarship.org.
God bless you. I'm Pastor Al McAllister, the pastor of Rafa Ministries Family Center Incorporated, and you are listening to Wake Up.
This is Pastor M.J. Wade of Perfecting the Saints Family Worship Center, Fayetteville, North Carolina, and we are excited. We are honeymoon happy and peacock proud to be a part of Wake Up.
We now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
Thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Now, before I introduce our second guest, I need to let everyone know that Cape Fear Valley Health, they're taking a health survey community needs assessment, and they're doing this in conjunction with the Cumberland County Department of Health. So basically what you need to do is please take the survey so they can see the health needs and the wants of the community. Now, if you say, well, Omega, how are we going to get the link? You already know Lindsay's got it for you. All you have to do is go to the live feed, look in the comments. You'll be able to click, you'll have a direct link to the, in the comment section. And guess what? It's available in both English and in Spanish. So make sure you take advantage of that healthcare assessment needs or health survey community health needs assessment. That's it. And because that's how they tell what we need in the community. There you go. So, ladies and gentlemen, it is now time for me to introduce our second guest. But before I do, I need to let everyone know that according to the Centers for Disease Control, more than 80% of pregnant-related deaths in the U.S. are preventable. But thanks to racial disparities in our country and in our health care, Black women are 3 times more likely to die from a pregnancy-related cause than white women. Here to talk about this subject is internal medicine resident Dr. Toyin Ingram. Dr. Ingram, welcome to Making Rounds Live.
Thank you so much for having me.
And you know what's so great? I'm over here grinning because Dr. Ingram, she can relate firsthand to this material that we're talking about. Because would you all believe that she is going to have a baby in 6 days? 6, yes. So, Dr. Ingram, first, when we talk about Black maternal health, what exactly are we talking about? Are we talking about during pregnancy, after pregnancy? Are we talking both? Things are bad, things are not so fatal or not necessarily fatal. Could you break everything down, that's included in this concept?
Absolutely. So, Black maternal health refers to the well-being of women of African or African descent pre-conception, meaning right before you get pregnant, during your pregnancy, and of course, postpartum. It also includes after you have the baby, up to a year. Black maternal health encompasses these 3 different segments, and it's something that we need to pay attention to. There are things that are red flags that you need to pay attention to, and it starts from even before conception. So as we delve deeper, we'll get to those topics.
On this show, we've talked a lot about racial disparities in health, in the outcomes, in whatever the case was. And we've talked about how the multiple factors all contribute. What does that look like for Black maternal health?
So for Black maternal health, like you rightfully said in the beginning, pregnancy-related deaths can be prevented, and you have in the United States 80% of women dying from pregnancy preventable reasons why they die. And Black women are 3 times more likely to die from these preventable reasons. For example, just to give you some statistics here, in 2021, I believe we had about 69.9 maternal deaths for every 100,000 births.
Wow.
And that was if you were Black, that was your number. If you were not Black, you were 26.6 deaths for every 1,000 live births, meaning at the end of your pregnancy you had a live birth. That was 2021. In 2022, that number improved a little bit. You had about 49.5 for every 1,000 live births for Black women versus 19 for every 1,000 live births. So the question remains, why this discrepancy? Like, what is going on here? We don't have stats quite yet for this year. Of course, we're not done with the year to know. The good thing, as you noticed, between 2021 and 2022 was there was a decrease. And that was because of the awareness that came with that alarming, plus we had COVID and the pandemic and everything that compounded that situation. So why did this happen will be the next question, right? There are a lot of factors. One of them would be implicit bias, for example. Things that we don't even realize that we're projecting onto others just by looking at them. They walk into the office and your mind goes a certain direction for whatever reason. Another reason would be structural racism. Another reason would be social determinants of health, meaning your economic status, proximity to healthcare services, ability to get to these healthcare services, even if they're close by. People don't really think about that sometimes, like that affects whether or not, patients get the care that they need. Other reasons would include the quality of care that you receive, being a Black woman versus not, Caucasian counterpart. And I think the last one, and I think in my experience is really a big deal, is underlying chronic conditions. We have certain conditions that are more prevalent in women of color versus not, and the management of these conditions too vary, depending on treatment, depending on availability of medications. Are you able to afford your medications? Things like hypertension, hyperlipidemia, diabetes. So if you take a combination of these factors I mentioned, the implicit bias, determinants of health and all, that would explain why these numbers are so big. So it's it's a structural thing.
Yeah.
It's not a small community. This is a nationwide issue that we're dealing with. So, unfortunately, these can be prevented if we just, start to make certain changes.
Do you feel that the conversation around Black maternal health is changing? I know that over the past few years, more of awareness has come about because Serena Williams talked about, she shared her story, Beyonce shared her story.
Right.
So do you think that the conversation is changing?
I think, yes, it is. And I think there's more awareness about it. You have organizations that have come together to, again, spread this awareness. An example would be the Hear Her campaign. And their focus is to alert women of these critical signs that if you find in yourself pre, during, or post, you need to go to the doctor. You need to speak about these things. Another one would be the Black Mamas Matter Alliance, and they are very focused on effecting policy changes to make, accessibility to health care more available for women of color who are pregnant, thinking of getting pregnant, or just had, birth.
Yeah.
But within the medical community itself, yes, the conversation is changing. There is a lot more awareness and push to make sure that we as physicians are aware of our implicit bias in dealing with pregnant women, and just being more aware of the things that we can change, from the inside, providing better care, asking more questions, trying to figure out the social determinants of health and how it affects that patient when they come in to get the care that they need. So yes, there is more awareness, and I think that's making a difference.
Dr. Ingram, what is the medical profession itself doing to address this issue? What are they, since you're a resident, what are they teaching future doctors about this?
Right. That's a great question. So for future doctors, I think especially those who are in medical school, the implicit bias and social determinants of health have been very big. And I've seen it across the spectrum, not just internal medicine, even in subspecialties too.
Wow.
Also, for example, in outpatient clinics, when you first meet a female patient who is in her childbearing years, you're taught to ask questions like, have you ever been pregnant? Is this your first pregnancy? More detail into their pregnancy history. Did you just have a baby? Or what's going on? How old is the baby? How are you managing? Trying to get that into place so that helps you guide your management for the patient. That's something that's also being, implemented in the training now. Other things would be, again, like I mentioned, implicit bias. I can't overemphasize that, how, the more you're aware, the less you're able to put that on people who don't deserve that most of the time, So, yes, that's what I know that we're doing, at least as far as I know in residency.
Ladies and gentlemen, we are in the process of a fantastic conversation with Dr. Toyin Ingram. She is an internal can I talk today, please? An internal medicine resident at Cape Fear Valley Health. And we're in the middle of talking about Black maternal health. Now, Dr. Ingram, for patients that want to be aware or they want to be an advocate for themselves,
Right.
what are some of the urgent maternal warning signs they need to be aware of?
Right. Thank you for that question. So, urgent maternal signs would include, I think this is very, very directed to patients who have, especially history of elevated blood pressure, hypertension, or any chronic issue, frankly. Urgent signs would include things like swelling of your face and hands, or you have, I know we all tend to swell, but I mean like swelling that's not going away, it's not relieved by laying down,
Yeah.
your feet are painfully swollen, that happens too, but where is a chronic problem? Things like that. If you have dizziness or you have headaches that wouldn't go away, or you have nausea and vomiting that is persistent, hyperemesis gravidarum, that you need to see your physician. So things like that are warning signs. A couple others include if you have your baby moving and all of a sudden they stop or they start to slow down movement, you need to see the doctor. These are urgent warning signs. They're
That is a
signs
very-
of impending doom.
I experienced that.
Oh, you did?
I experienced a
Oh, my.
stillbirth that very same way. Yes, ma'am.
Oh, sorry to hear that.
So, but go ahead. I didn't
Yeah.
mean to cut you off. But go ahead.
It's all right. Other signs like if you have vaginal fluid leaking or you have bleeding, when you're not supposed to, obviously, for whatever reason. If you have a fever, contact with people who have been sick recently and you're not feeling quite well, and, again, spiking fever over 100.4 degrees, you need to see
Yeah, you
a
need to go to
physician
the doctor.
about that.
Yeah.
So those are some of the warning signs. Changes in vision, that is typically
Something as small as vision.
yes. Changes in your vision typically would come about if your blood pressure is high, which is why I placed that in the 1st sentence. Like, this is very related to high blood pressure, but there are other things that are not really high blood pressure related. So
Okay.
if you have changes in your vision, headaches, dizziness, swelling that doesn't go away,
Yes.
then yes, those are urgent signs. And like I mentioned earlier, the Hear Her campaign, that is their focus, is to make sure that women are aware of these urgent signs. So it's not like, I thought it was nothing, and then,
Yeah.
you end up being a statistic. So,
Exactly. What about on a community level, Dr. Ingram?
on a community level, I was able to find some resources. One of them is the Agape Pregnancy Support Services. They do have a number, and I will share that later. Well, I do have it written down, 910-485-0555. Okay, and that's here in Fayetteville. There's another one, Operation Blessing of Fayetteville. It's right here on Ramsey Street. 910-483-3111. Yes. And of course, the North Carolina Department of Health. There's a whole section for pregnancy services that they provide, and that includes, again, preconception counseling, pregnancy, your OB visits during your pregnancy, and postpartum counseling too. And let's not understate the importance of mental health during your pregnancy.
Yes.
It is so important to have a social community, somebody who's advocating for you, someone who's talking to you about these issues and helping you, support you during your pregnancy. Because, those OB visits, no joke. Especially towards the end when you have to go every week. So, yes.
And toward the end, yes.
It can take quite a toll, yes.
What advice would you have for the support team, the relatives, the husband, the sons, the daughters? What advice do you have for them while their loved one is going through pregnancy?
Support, and advocate. That is the key words. Those are the key words. Okay, so first I would say advocate for yourself.
Yeah.
As the patient and as the support system for the patient. If the patient is having some hesitancy about discussing their concerns. That's okay. You can bring it up too. Okay? I always tell my patients, it's your life and it's your body. I am just a tool to help you stay alive. Okay? That's you. We come together and discuss your care. I'm not here to tell you do this and do that. We have to, it's an alliance to make this work. The other thing I would advocate for support, family members to know is to know these urgent warning signs. So the things I've mentioned, the headaches, high blood pressure, swelling of the legs and face, the vomiting, can't keep anything down, dizziness, changes in vision, things of that nature. Familiarize yourself with these things. So if you notice them, and mom might be saying, oh, I feel okay, I feel fine, but you're like, this is week 2, you have not had anything to eat and you're vomiting.
Or the baby hasn't moved.
Or something of that. There you
Something's
go.
wrong.
Advocate for them. Sometimes they might not be quite okay to speak for themselves. That's your position. Another thing would be to again, like I mentioned, social and mental health. Try to help in every way you possibly can to keep mama stressed down. Okay, and then postpartum especially. Because we have mothers who typically have other comorbidities, kidney disease, diabetes, hypertension, and pregnancy. Now, baby's born, mom is alive, everything's fine, thank God.
But
when you
now-
go for your postpartum care visits, make sure your doctors are aware of everything else that has happened between delivering the baby and that visit. And if you go to see your kidney doctors, your heart doctors, let them know, hey, I just had a baby. Because, for example, in cardiology, there is certain ailments that occur up to postpartum, and that's because you were pregnant in the first place. So these are things that you need to share. Your postpartum history needs to be known by every doctor. That way they can collaborate and say, okay, it's likely this because of pregnancy and less likely that because patient was not pregnant. It just helps to have that information together.
All right, Dr. Ingram, I see the producers over there in the corner out of my peripheral. So that means we've got to wrap it up.
Wonderful.
So
Thank you.
what is the most important thing about Black maternal health that you want our listeners and viewers to remember?
I would say you matter. Your health is priority. And it starts before conception. So take care of yourself. Take care of yourself during pregnancy, and of course after. And advocate, support. And that would be it.
Ladies and gentlemen, internal medicine resident, Dr. Toyin Ingram. Dr. Ingram, thank you so much for taking time out of your schedule to be with us today.
Thank you for
and
having me.
good luck on the baby.
Thank you so
6
much.
days, y'all.
I'm excited.
She is doing an interview. And in 6 days, she's going to be delivering a baby.
Yes.
Who does that? But anyway.
I'm excited. Very, very. Thank you so much for having me.
You are so welcome. And ladies and gentlemen, please join me in thanking our guest again today. First, we had, Lord, I forgot his name just that quick. We had Mr. Michael Tart with us during the first segment of the show. He is Highsmith Rainey Specialty Hospital's president. He was telling us about the different services that Highsmith Rainey offers. And, of course, Dr. Ingram, who talked about Black maternal health, who is about to be a mom in 6 days. I'm sorry, I'm just giddy. So let me go ahead and wrap everything up before I get mean mugged again. Our next broadcast is Tuesday, June 11th, when we'll talk about more important health topics involving our community. So we hope you we hope you join us. For our producers, Shaka Jordan, Ray Thomas, and Lindsey Graham, and the amazing team behind the scene, I'm Omega Jones, remembering the legacy of Darvin Jones. Thanks for listening to Cape Fear Valley Health's Making Rounds Live.